going back to the study showed before, just showing that with opioid maintenance therapy, there's decreased HIV infection, incarceration, drug use, and mortality. So those are some pretty important benefits, obviously. And then, I don't understand. Hang on a second. So this slide is about needing to continue treatment. I think we've been really hammering that point home. Other chronic treatable diseases include obesity, hypertension, diabetes, asthma, and addiction. So I think there's an underlying theme here, which is that addiction is a disease. Refusing to treat an alcoholic who relapses is like refusing to do a cardiac bypass for someone who continues to eat hamburgers. And I have treated many of those patients, and they often eat hamburgers. And if you remember just one thing, because I think there are studies that from a long, boring PowerPoint presentation, you remember approximately 2 to 3 facts. So I wanted to get in on what those facts should be. I think number 1, addiction is a disease. Like, it really just is. It just is. It's a disease. And then number 2, addicts are sick people. They are not bad people, and they really deserve our help. And then, I also just want to thank you all for your attention and thank Dr. Christensen.
Any questions or comments? Sir.
Yes. In working with people, one thing, in terms of the basic theory of addiction, how do you explain to the individual who is pretty firmly diagnosed as having an addiction to, let's say, alcohol, and they experience pleasure response to other substances or behaviors, but do not develop the addiction process to those other substances or behaviors, which the theory almost says they're going to.
I've had that conversation, and what I tell them is, you probably drank safely for a long time, and you may or may not get in trouble with this behavior, but there's a good expectation that it could happen. And typically, you're talking to an alcoholic who is gambling or getting involved in some kind of behavior that's going to turn into a problem.